My name is April Watley. This is my AVMA video for Clinical Pathology 2, course number 2331-34430 for summer of 2017. This is our ProSite machine for running CVCs. I'm going to run the quality control. Picking number 2 because it's L2. You can sort of see it. And then run quality control. So I warmed it up. It's been waiting about 15 minutes. I'm gently inverting until cells settled at the bottom are completely suspended. I think we're good. Air bubble off the top. These are my instructions, and I'm hitting start. And that's running the quality control. And then if I were to clean it every month, we use this cleaner, but it's not that time. It's kind of like a bleach cleaner. And we basically run it through the analyzer, and it cleans it for us. I'm going to look at my quality control results. That looks good, and I'm going to print it too. See what happens. Here are the results of the quality control. It looks great. Okay, I'm going to do a 40th snap test. I'm getting my stuff out right now to let it warm up. Here's the snap test. Here's my little container, little tray, and my conjugate. I'll set this up here. This all together. So I have the instructions, and it says 4 drops of conjugate. 1, 2, 3, 4. And 3 drops of sample. My lavender top tube. Pop that open. This is just an air bubble. One, 2, and 3. So I'm going to rock that and let it sit for a few minutes, and then I will start a new video when this is warm enough to run. Okay, this is room temperature now, so I'm going to add my sample to the well. So I'm gonna snap that down and set a timer for 10 minutes, and then I will be back with the results. Down there, fecal float. Got my Fecasol. Now, some people like to do the slide like this. I'm going to leave that for 10 minutes and come back to it. I'm going to do a couple fecals. This is going to be my direct smear. Got my stool sample. Just gonna lovely. Smear on there. Fecal float. Got my Fecasol. Now, some people like to do the slide like this. I'm going to leave that for 10 minutes and come back to it. Okay, fecal is done floating. This is the tricky part. Slide on that, and then I'm going to go check it. Oh. I'm going to do my fecal smear now, my direct. So I'm just going to put, oh, that was a little bit of fecal sediment. And I've got a pretty small amount of stool. Okay. I'm just going to take my sample here and just mix it up. It's lovely. Big pieces out of here. There you go. And now I'm going to go check it out, make sure there's no parasites. Okay, so sediment. Actually, I'm going to do this with gloves on because it's kind of gross. Okay, I mixed it all up. I do this as gracefully as possible. It's not working. Leaving a small space at the top. I'm going to cover it for good measure. Then I'm going to centrifuge for 5 minutes. I'm also going to go ahead and spin down my sedimentation while I'm waiting, while I'm going to spin down my centrifuge. So got my tap water. Shake this up. Mix it up. I'm just using these plain white top tubes for this. Put out my gauze. I'm going to label this sediment so I know that it's the right one. Okay, this is my float. So I'm going to add my centrifuge float. That's it for 10 minutes. And my sediment, dumped it all. Okay, try this again. Cover slip. I'm going to go look at it under a microscope. Okay, here's my centrifuged float on microscope, and now I'm going to go check it for parasites. Okay, I'm running a creatinine, selecting my patient, running on plasma, creatinine slide. Slide is on, sample is in, hitting run. These are the results of my creatinine. Nice and normal. Nope, come here, lay down. Okay, I'm gonna get a swab from her left ear, which is actually not that bad now. Okay, I'm going to break it so I know that this is the left. I'm going to swab from the right ear, which is the one that she gets yeast infections in. Oh, Gross. Put that aside. Okay, my ear swabs. This is the left, the one that I cut off. Just gonna swab it all over here. And the right, oops. Also gonna swab it all over. Now my lighter is missing, so I'm gonna have to use a blow dryer to heat fix this. Hopefully that's good enough. I'm gonna have a quick stain. Here. It is very low. Okay, I'm gonna do the same with the left and then let them dry. Okay, this is the right ear. On 100X under oil immersion. Oops, that was too much oil.
I wish that I could reincarnate myself into Duke King.
Hang on, I got it. I'm just looking for yeast because she had a yeast infection once. And she's passed her medications, and I just want to make sure she didn't recur. I don't see any. I don't see anything on the left ear either. Me? Okay, I'm back in lab, and I didn't see anything on the left slide, but on the right ear I did end up seeing one yeast, which makes sense, but it's way better than the tons of yeast that I saw on her last cytology, so good. That's okay. So, no nasal or ocular discharge. Oral cavity abnormalities. No obvious abdominal masses.
no extremities, malformations, or pathology noted. No lymph node enlargements. Genitals normal. Okay, scalpel, please. Ventral midline incision. From sternum to what is that? That is pubis bone.
Let's do, what, is that on both of them?
Couldn't say her doctor.
No. This much pain.
This might be the small spare one.
Going to open the chest cavity. Stabilize, yes, please. It's easier to make incisions on both sides of the sternum instead of going through. Rotate it out. Now do you hold that?
Hey, April. Lionel just had to leave. Jim was in a wreck.
Okay.
So somebody took over.
Oh my gosh. Okay.
So he's gone.
Okay.
So, we evaluate right away, start in the chest cavity. The lungs, I don't see any abscesses, any gross pathology at all. I'm going to take a sample of this lung lobe. That's in bed, please. Okay.
What's that?
Heart? Yeah, I think it is. I see it's good. Yeah, it is. Yeah, it's hard to tell, but it is. They kind of clap right on it.
Oh, okay.
So specimen jar, please. Now I'll proceed to the abdomen. The liver looks normal. There's no gross pathology noted. Intestines are normal diameter, coloration. Move those and we can
I'm sorry.
you help me identify the kidneys. And hold your back down here.
Can you hold a second?
Mm-hmm. This is there. Right there. The left kidney. See the right kidney. Right kidney right there. Okay, look north. Okay, aorta. We're not going to be able to view the adrenal glands, I believe. Yeah. Let's get some, let's put that intestinal tract back in and see no abnormalities there. And look at the section of the liver.
I think that's all the samples we need there. Does that sound
Okay.
good?
Okay. Alrighty then. Anything unusual you see in there?
It's
Pretty normal.
very normal to me, yeah.
animals there since you've seen it? Seen it forever,
Break open there.
yeah, I got a little bit. Sadly.
Yeah.
Really good.
Double check.
This is liver. Heart. And lung. So, rabies patients. The only people that can handle a rabies suspect would be anyone that is vaccinating. Generally, all DVMs are vaccinated. We try to keep 1 or 2 technicians vaccinated, one at least for the overnight shift and one for the day shift. That way, if we have a rabies suspect or even something that has bit someone and is quarantined, only someone that is rabies vaccinated can handle that patient. Protective gear. Computer's dying. Okay, sorry. Protective gear. You should generally wear all PPE. You don't want anything getting in your eyes, getting in your mouth. Goggles, mask, maybe mask with the face shield, gown, gloves, booties, everything. Pretty much an isolation case in general. Basically, a reverse isolation is what we would call it. The specimen that is submitted would be the head of the animal. It cannot be frozen. It must be kept refrigerated. It needs to be shipped on ice, and it needs to be shipped quickly. What we do, the county actually comes and picks it up from our clinic, but I think that varies county by county. The remainder of the body is not to be buried unless the results come back negative. So it can be, cremated, or the body can be put on hold and kept separately and until results are returned. Thank you. Okay.
Thank you.
So just put it on here and dab it. Oh, I know. I'm killing Luna. Dab. And would you just moisten the swab with saline too? Yes. Yeah. Gosh, I'm sorry, Luna. Yep, we can actually get it on. Okay, that's good. Okay, so I'm gonna go up and in.
Right. Okay. So when you put it in, you want to go pretty much perpendicular to the vagina.
Okay.
So just kind of get it in there and stick it upwards as far as you can.
Okay.
And you can help by pulling on her vulva.
Okay.
Down.
Pulling down.
Yeah.
Can you hold hair back for me?
Yeah.
This is it's tricky. Okay, so pull down on her vulva.
Yeah. So put the tip in, and
then pull down.
then you want to aim more that way. Yeah.
More which way?
So when you go in, you want to go in that way. Up. Yep. Now pull down on her vulva to help get it even further, and now and then you turn it. Then you turn it this way, and then advance. And then you just kind of roll gently. I'm sorry, Luna. And you can take it out. It doesn't matter.
I'm sorry.
I'm gonna caution.
She is not going to caution.
Go ahead and stop it.
That's why I let go. Because she was jumping up and
Vaginal cytology time. This is my sample from Luna's vagina. The slide, cleaning off. And I'm just going to roll my sample onto the slide. Okay. Have a good few days off. gonna stain it. Right here. Oh, can you see it? These are our slides. Staining. I'm gonna do 10 quick dips in each. Here's my stained slide. You can sort of see it in this light, and we're gonna go to the microscope and have a look. Mostly debris. Okay. Bless you. So all I'm seeing are intermediate cells, which makes sense because my dog is spayed. But generally, if I was seeing intermediate cells, primarily, then the dog would probably be an anestrus. I will come back and discuss more. I'll come back and discuss more about the cycles whenever I'm not at work, when I'm at home. Okay, so I'm going to discuss the 4 stages of estrus and what I would have seen on the cytology whenever I was looking at it. If it was anestrus, I would have seen a mixture of intermediate and parabasal cells. This is what I saw on Luna, was intermediate cells, not very many, but they were there because she is spayed. If she wasn't and she was in proestrus, I probably would have seen a large amount of red blood cells, parabasal cells, intermediate cells, and superficial cells with a lot of bacteria. But we would be shifting over to more superficial cells. If she was in estrus, I would have seen mainly anuclear, superficial cells with bacteria attached. There wouldn't be as many red blood cells as there were in proestrus. If she was in diestrus, there would be way less superficial cells, but there would be an increase in intermediate cells and parabasal cells with some debris. It would look similar to anestrus. And if she was pregnant, it would also look like diestrus or anestrus. Thank you. Putting the oil on the slides. Just one drop. Okay. Oh my God. Okay, you want to layer lateral with that right elbow up?
Come
Luna,
here.
come here. Lay down. Right now.
Now you're going to be on the wrong side for me.
Oh, is it the left elbow that I need?
I believe so.
Okay. All right. Turn around.
All right. Ready?
Yeah. Okay, stay. Okay. Little spot here. Do you go with the grain or against it? Because I never really cared.
I don't think it matters.
Yeah. Oh, good girl, Luna. That looks like a good spot right there. You can actually get anything off of it.
And the stuff on the blade you can always put on the slide too.
Yeah. That's what we always did at the RV I worked at. We just kind of dabbed it on there. And then you use tape, huh? Sticky side down?
Mm-hmm. And then you can yeah.
And then just tape it to the oil, huh? Mm-hmm. That's interesting. Cool. Okay, this one's. Okay, so I'm gonna look at my slides of the skin scraping of Luna's elbow. I got two different options here. I've got the tape option and the slide with the cover slip that I just put on. I'm just gonna look at it at 40. And I'm essentially looking for any mange, any mites. I like to look at it a little darker. I feel like I can see better. There's my corner. So I'm just going to go around and see if I find anything. I didn't see anything on the cover slip. I'm going to try this tape method. See what I can see here. Okay, she's all clear for external parasites. Okay, I'm going to make an attempt at this cross match. I've got my serum sample and my EDTA sample. I just need to spin this down and get the plasma off of it. Okay, so I spun down the EDTA. This is my serum. It should be there. Okay. Now, we don't have these 12 by 75 millimeter glass test tubes, so I'm just going to use a plain white tube that doesn't have anything in it. So I'm going to do, okay, 1 to 2 drops of the blood. One. Ooh. It's thick. 2 drops. I'm gonna have a bag of saline here. And I will fill the rest with saline. Ooh. This. I'm going to centrifuge it for 1 minute and then come back and do it. Okay. There's that suspension. So I'm going to empty that as well. Okay, this is my recipient's final wash and then my donor's final wash. They're both clear and colorless. So to make my 2% suspension, this is my 0.98 mils of saline. So this is my recipient. I'm going to draw off the saline. There. 2 mils of packed washed erythrocytes. Let me get down in there with this. Perfect. So 0.02 milliliters. My erythrocytes are going into my recipient. So that's that. I'm going to do the same with my donor. Ooh, I am a klutz today. I have to use the needle. It's not working too well. I'm just gonna have to guess. I'm just gonna have to guesstimate with this one. Okay. Okay. So here's my recipient. Here's my donor. 2 drops of serum, 2 drops of donor. Okay. Oh my God. Okay.
Get into the refrigerator. Ooh.
Oh my God.
I know Shirley keeps
2.
telling Dr. Williams to just fall. She's like, you need one person. Get her.
2 drops of donor cell suspension. I'm getting a new tube every time I do this. Donor cell suspension. One, 2. So this is the major cross match. Major. So for the minor cross match, so I've got the donor's serum, which is now on the floor. I hope I got enough. 1, 2. With 2 drops.
They're too heavy. To do like a full circle, right? Around the left. You're stuck in there, silly butt. It's the corner.
One, 2. Minor. Okay, to check for, I was not recording, but this is my donor's, what's the word for it? Control. And then, that might be my recipient's control. too. One, two. Okay. Shaking them gently. Shaking them gently. And then I am going to let them sit for half an hour and I'll come back. Okay, I'm back. I'm going to centrifuge these for 1 minute and check and see if you've got any agglutination. Be right back. Okay. This is our major cross match. It looks really good to me. Yeah, actually. I might be seeing. Ooh. I think actually this is not a good match. No, it looks like there's some agglutination on the major cross match. And the minor, there's mild hemolysis. I'm gonna look at this under a microscope just to see what the agglutination looks like underneath there. But I think that's macro, so be right back. Oh, before that, our controls look really good. They look perfect. So now I'm gonna go check this. Here. I'm gonna go ahead and video myself doing the slide. It's really hard to tell. Okay, we're back. So I did find some microagglutination. I'm going to flip the camera around and show you the micro. There's our microagglutination on the top right there.